Adiban. Once again, we are sorry for the delay in our program this afternoon. We are so sorry due to technical problems, but we are back and we are ready to learn. Today, we are coming to talk about danger signs in pregnancy. So, or pregnancy warning signs. So, what will tell you there's a problem that you need to seek help? And research has shown that about 80% of miscarriages are caused by one of these danger pregnancy signs. So somebody will say, what are the danger in pregnancy, or what is danger pregnancy? So there are signs that you see it physically, which is exhibiting, that shows that the pregnancy is at stake, or the mother's life is at stake, and the baby's life is also at stake. So we at PZ Customs Ghana, we are coming to talk about it. We are coming to delve into it for our viewers to know and learn, so that you share with yourself, your friend, or your neighbor, so that anything that you see which is unusual, what needs to be done. So on my screen, we are going to see a nice chart that we are going to talk about it one after the other, one after the other. And I'll let my cameraman put on the screen so that we can talk about it. So the first one we are going to go talk about is severe headache. So frontal severe headache, the headache that you feel on your forehead is so persistent, it doesn't stop. It continues no matter the para that you take. You know, when you are pregnant, you go for antenatal. We write painkillers for you. You take it as and when needed. It's not a routine medication that we give. So when you take 1 gram, which is 2 tablets of the paracetamol, morning, afternoon, and evening. So you take it, and still for 3 days, the pain still persists. What we say is the pregnancy is telling us there's a problem somewhere, because you can't have continuous headache that you are not okay. So we are saying that we should bear in mind we have headache and we have severe headache. Maybe before you got pregnant, you were not experiencing those problems. By immediately pregnancy occurred, you start having severe headaches. The headache, no matter how much you rest, no matter how much you sleep, no matter how much painkiller you are being given, the headache still persists. And that one is a danger sign for us to know that you, the mother, your life is at stake, or the baby's life is at stake, or both of you. We can lose both of you. So you need to rush to the clinic, talk to your midwife with all our antenatal cards that we have. These are beautiful antenatal card. There's a section that the midwife writes her name and her telephone number. I just want to open it to my viewers so that they will see. So make sure when you have your antenatal, your midwife name is supposed to be here and her contact number. So based on that, you can call your midwife, report to her even before you get to the health facility, so that the needed support that needs to be given to you, it will be given to you. The next one is swelling of the feet, which we call edema of the feet and the arms. So swelling of the feet, your feet get swollen. People will tell you are coming to give birth to a boy or twins. It's not true. When you go to the clinic and the midwife presses, or you yourself at home, you realize your feet or your arms are getting swollen and you press, When you press and it falls in, it takes a longer time before it comes up. It's called pitting edema. That is telling us it's also a danger sign. It can lead to eclampsia or pre-eclampsia or eclampsia. At the same time, also the severe headache can also be a sign of preeclampsia or hypertension in pregnancy. So we are saying that all these two things is telling us that your face shouldn't be puffy, your nose shouldn't enlarge unusual, your hands shouldn't be puffy, your feet, so though upper extremity and lower extremity, it shouldn't be puffy, and it shouldn't pit. That is, when you press on it, it should rise faster. It shouldn't take a longer time. So we should bear in mind when your arms, your face, your legs are swollen, it's not twins or a boy, it's a danger sign. Then we have another one. When you are not pregnant, everything was okay with you. Pregnancy occurs, you realize that the least thing you do, you feel feverish. The least thing you do, you start convulsing. So convulsing is also not a good sign. It's a danger sign. There's a difference between epilepsy and convulsion. Epilepsy is maybe it was already on you. Those ones you can say a child can be born with it, or it can be acquired whilst growing up. But this one, you've not experienced it before. Immediately you get pregnant, you start fitting. The fitting can be a sign of preeclampsia or eclampsia. It's one of the cardinal signs that we know that the mother's is entering into the danger zone, and we can either lose the mother or the baby. Then also, the water that covers the baby, the amniotic sac, it has water in it. This water is supposed to break when you are in labor. So when the water breaks before your due time, it's a danger sign because the water can get finished and the baby can die in utero and you can lose the baby. So we are saying that we should pay critical attention. It's a colorless, odorless, whitish liquid. I'll take it again. You see the way water looks like? That is how it looks like. So it's a colorless, odorless liquid. So when you are pregnant, you really need to pay attention to yourself, especially also when in our antenatal books, we are supposed to do scan 4 times before we deliver. So the midwife, per the bag of water, definitely she will measure your tummy. She can estimate, but the correct, accurate answer is when you take your scan or the sign you see if the water breaks. When the water breaks, please don't stay at home. Rush to your nearby clinic. Then also, dizziness and fainting spells. When you walk for a while, you feel dizzy or you get those fainting spells. We are saying that it's not a good sign of pregnancy. They are danger signs. When you are pregnant, you don't need to feel dizzy. When you are pregnant, you don't need to have fainting spells. Rather, you should be strong enough to carry the pregnancy through. The next one is blur vision. So, whilst pregnant or before getting pregnant, you are not having issues with your vision. Pregnancy occurs, blur vision starts. It's a warning sign telling us one, we can lose you. It's not good. It's either maybe you're even losing your sight. People get pregnant and lose their sight. It could be eclampsia or preeclampsia. So we are saying that when you start experiencing blur vision, please report. Don't take it as one of those things. Maybe your mother or your mother-in-law will say, oh, when I was pregnant with you, this is how it was. So it's normal. There's nothing wrong with it. No, there is something wrong with it when you start experiencing blur vision. Then also, when your heart beats rapidly beyond small thing you do, you get tired, then the heart start beating rapidly. It's also not a good sign. Then increase in body temperature. You are sleeping in treated mosquito net. They've given you a prophylaxis in malaria. You have taken it. You don't sit outside for late. You have done everything to prevent malaria, but your body temperature keeps on rising, 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 and gives you the urge to take in a lot of water. You feel thirsty, especially at night. When you have to sleep, you need to drink a lot of water. Your body temperature is so high, above 45 degrees. It's not normal. When the test increase and you start losing weight, but your tummy start growing big than usual, possibility that we are developing gestational diabetes is high. So when you look at all these signs, when you put all together, it's either leading us to one, miscarriage, two, eclampsia or preeclampsia, three, pregnancy induced diabetes. Then four, it can also lead us to cardiac problem when you look at all these signs. So we are saying to all viewers that please don't sit down. Don't say it's okay. Oh, I'll be fine. My first pregnancy, this is what happened. My second pregnancy, this is what happened. No, we don't have to say that. At the end of the day, anything that we see that I've mentioned, they are not normal. We need to rush and see our physician or our midwife. Then increase or decrease in fetal movement. By 16 weeks, which is 4 months, we are expecting the baby to kick. That is the first kick. The baby should be able to kick. Then also, from 28 weeks all the way to delivery, we are expecting the child within 24 hours a day. The baby should kick no less than between 12 to 18 times. So it's like a clock, 360. When it kicks, it needs to go around clock, and kick again. That is one kick. That's why we give you the fetal kick count sheet, teach you how to do it at the antenatal, so that you mark it from 28 weeks all the way to 40 weeks. So that when you are coming for antenatal, you come and show it to your midwife. Aside that, you pay attention to it. So that when baby is not kicking or baby is over kicking, you can rush with your kick count and your antenatal card to see your physician or see your midwife, so that the necessary intervention can be taken to save you and your baby. Then when you have smelly or greenish or yellowish fluid coming out of the vaginal orifice, one is an indication of an infection. The type of infections, it varies. It varies. It could be sexually transmitted infection. It could be UTI. It could be anything. That's why we are saying that if you see any smelly or you feel when you take your panty off, you see a greenish or yellowish discharge, which is so fishy smelling, please don't hesitate, but go to the facility and let's assess you. And one thing about this smelly, fishy discharge that comes, if you care is not taken, the os can open and premature delivery can happen. It makes that place so softened because whatever is causing that are microbes that is making you have that discharge. It makes the cervix so tortuous that and so sensitive. So anything down there, when it becomes too much, can actually harm you, the mother or the baby. Your time is even not yet up. Maybe you are 4 months, 3 months, 5 months, 6 months. You can enter into labor and give birth to a premature baby. Possibility that the child will survive is 50-50. because if the baby is not fully developed, possibility that the child will survive is so less. When the child even has developed fully but is premature, it's not every child that survives in an incubator. So all we are asking, we need to carry our baby to term and make sure we deliver the baby. And then persistent vomiting. So we know in the whole day, mother has vomited more than what she has taken in, the fluid, the whole day. For instance, you took in 10 mils of water and you have vomited 50 mils. It's not good. There's a difference between hyperemesis gravidarum and persistent vomiting. The hyperemesis gravidarum always happens in the first trimester. That is the one you conceive all the way to 14 weeks. That one is part of minor disorders in early pregnancy. But after 14 weeks, we're expecting everything to normalize. Even the hyperemesis is not something that is continuous because you only vomit in the morning, then you should be able to eat, take in more of your fluid, more of your food to replenish what you've lost. But this persistent vomiting, anything that falls in your tummy, you vomit. You vomit everything that comes, so you can't even replenish yourself back. And you realize you become weak and weak each and every day. Even for the first 2-3 hours when you vomit, you become so weak that you can't even stand on your feet. And that one is a serious issue. We are saying that please don't stay home. Whether you take in fluids, you take in fruits, you take in food, and everything comes out, please let's rush and see our midwife or our doctor. Then severe lower abdominal pain. It's not contractions, it's not Braxton Hicks, it's the pain that even you can't stand straight. It starts from your lower abdomen and it radiates all the way to your back. That severe lower abdominal pain is not that you are in labor. No, you are not. We are telling you that there's more to it. It can be the baby is in distress. It can be there's an infection. It can be there's a problem somewhere that needs to be tackled as soon as possible so that we can save you. When baby is in distress, that is, baby is not comfortable, baby can't breathe well. So the baby is actually struggling for his or her life. So baby will overkick and kick, and you realize that the pain that you feel is so much that you can't even bear it. Then we have bleeding in pregnancy. Bleeding in pregnancy, that is, you bleed whilst you are pregnant. One thing we should know that immediately you conceive, it's already 4 weeks, which is 1 month. When you miss your period, you're expecting your menses today, 28th of September, the menses doesn't come. Automatically, you are pregnant for 1 month, not one day. So when bleeding starts, that should tell you a part of the baby. We have implantation bleeding. Those ones are normal. Those ones are that pinkish, light red blood that you see. And those ones even are spots. They are not continuous. And those ones happens in early trimester or the first trimester. But second trimester, third trimester, you are bleeding. It could be placenta issues. So it could be the placenta is so down. It could be the placenta is detaching. It could be placenta has actually detached already. So baby is not surviving. Baby is not having air to breathe. Baby is not having nutrients to feed on. Baby is not having water to drink. So we need to act as soon as possible by saving the baby and also making sure mother is also fine, because when you overbleed, anemia can set in. And when the anemia sets in and you don't rush, you can also lose the mother. So anemia is when the blood of a pregnant woman is below 11. When you look, WHO says From the one you get pregnant all the way till you deliver, we are expecting your HB should be around 11 or 11.5 upwards. It shouldn't be below. So whilst I talk to you, if you're watching me, you are a pregnant woman, just open your antenatal card. We have a portion that we write your HB the first time you step in the facility. Then we repeat it at 28 weeks and repeat it at 36 weeks. 36 weeks because you have 4 weeks to enter into labor. We are expecting before you get to 40 weeks, you should be around 11 or 11.5. So bleeding also is not a good sign in pregnancy. All these things that we've spoken about, they're essential. They are core for the survival of the mother and the baby. Then also, we call something varicose veins. Now, we have some mothers, they have the varicose veins. They are so tiny and small, they don't even see it. But immediately they are pregnant, the varicose veins becomes so big, so huge, and edematous, full of blood. So any small thing, it triggers it. The varicose veins can equally even burst, whilst nothing has even touched the varicose veins on your leg. So those ones too, we have a special stockings that we give to the mothers that they wear throughout the pregnancy, all the way to the labor room till they deliver for postpartum up to 6 weeks. By that time, we're expecting that the varicosity should come down. Everything should be okay. There are others also who doctors will recommend or their midwives will recommend creams. There are special creams for it that you can apply on it so that the varicosity can come down. Aside the legs, you can also find varicosity around the vaginal area, that is the orifice, or on top of the vulva, or around the vulva, or even inside the vaginal walls. So you should know yourself and know yourself well. That's why when you are pregnant, the midwife will do her thorough examination from head to toe, making sure that everything about you is okay. Your midwife will also educate you on all the danger signs for you to pay attention to every one of it, so that when pregnancy occurs, you can actually know what you have to do so that you can go through the pregnancy successful. With all these danger signs that I've mentioned, there's one key person which will play an important role in the life of the mother when she's pregnant. That is the partner or the spouse. So, or the emergency contact of anybody, either your mother, your sister, your brother, or your friend. Immediately you see any of it, you have to alert that person close to you so that they will do as much as they can to rush you to the nearby facility so that you will be safe. This month, we celebrated Childhood Cancer Month. When you look on my chest, I have my yellow, beautiful flower, which is for all children in the world who are battling with cancer. Research has shown that with every child which is born today, as I'm talking to you, when you take 10 children, you can get 2 who can be diagnosed as having childhood cancer. Now, the latest research which has shown is when you look at the eyes of your baby, you see when the child wants to develop or cancer is developing in the child, you see the black. I wouldn't use my words because a mother of mine sent me a message telling me when I use big jargon, she doesn't get to see. Then your eyes, some others are brown, others are black. Then when you look straight, you see that it will start forming white patches gradually. That is the pupil. It starts gradually. It starts with a small white, then it starts enlarging, bigger and bigger and bigger. It's a sign that your child is starting to develop childhood cancer. And research also has shown that when you take 10 children who are suffering from cancer, 8 of them are suffering from leukemia, that is blood cancer. So, what is telling us as mothers, what we eat has an effect and toll on our children because cancer cells multiply a lot, especially when you are pregnant. They multiply a lot. So, what are we supposed to do as mothers when we are pregnant? One, visit the nearby clinic as soon as possible. You take your prenatals. When you see anything unusual, you rush to the nearby clinic. When you give birth to the child needs to take all his or her vaccination. If you don't understand anything, get closer to the public health nurses or your midwife. The first 6 weeks, she will actually explain so many things that goes into it that the child needs before the child celebrates his or her first birthday. And research has also shown that a lot of children don't live up to 10 years and they die. So childhood cancer is real. Children are dying of childhood cancer. Children are losing their hair because of cancer. Children are losing their limbs, both upper and lower limbs, because of cancer. Children are losing time to even spend with friends, time to go to school, time to learn to be who they want to be in future. We are losing a lot of children for childhood cancer. So we at PZ Castles Ghana is adding our voice to it, telling everybody that it is real. Let's pay attention when we are pregnant. Pay attention to our children when they come. Whatever that they show, anything that is unusual about the child, please, let's seek counseling, let's seek the education, and let's seek guidance. Then also, anything around your child's head, the arms, the face, the body, which looks like a pimple but is painless, please don't squeeze anything out of it. It's best you seek a second opinion from a medical personnel, somebody who has been trained and who knows, oh, this is nothing. If it's nothing, definitely, even before you even get to the facility, it will subside on its own. But if it's something, it will start going bigger and bigger and bigger. So let's remember that. Tomorrow, also, we are celebrating World Heart Day. And we at PZ Customs Ghana is adding our voice to it. We are saying that everybody above 18 years, it's good for you to go and have your body examined. And to us also, the elderly, those of us who are hypertensive patients, and those of us who are not, but we are doing strenuous job each and every day, let's try and check our BP regular as possible. Then with our children also, let's pay attention when they come from school or when we are with them in the house and they complain, Mommy, my heart. When I do something small, I feel the pain. Daddy, when I do something small, I breathe fast, 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 fast. Let's pay attention to that. And let's all come together to protect our heart. When you have a good heart, you have a good mind, and you have a good soul, and you can live long. Then 4 days ago also, we celebrated World Family Planning Day. You see, we have a lot for all of you. World Family Planning Day. So we have types of methods that we have: the short term, the long term, and the permanent methods. So the short term, some are the pills, some are the injectables, and the condoms, of course. Then also the calendar method. And the natural method. So the natural method is exclusively breastfeeding your baby for the first 6 months. Those ones are the short-term methods. The long-term methods are the implants and the IUDs. So, and the permanent methods is the BTL and the vasectomy. We are saying that you should have what you know. That is you visiting the healthcare provider, your midwife, having a discussion with her so that you can have an informed choice. Then you can choose one so that you can plan for your family. Anytime you plan your family, there's always happiness in the house. The father is always happy to come home because the children are well spaced. So the joy and the happiness will be there. Money will be saved. Children will be well taken care of. But when you don't plan properly, the man will be running away from you. There'll always be chaos. And if you don't take care, the children will be school dropouts. And we don't want that as a nation. All we want is to produce good, responsible citizens of Ghana. So, we came your way to have a nice discussion with you. We are sorry once again for not coming your way due to one or two technical problems that we encountered. But we are saying that we are always here for you. Visit our pages with your questions. Come, we are always there to answer. Even after the program, when you bring in the questions, we'll definitely answer your questions. We'd like to say thank you to all our viewers who has joined us today, who waited patiently, those who were calling, those who were texting, those who were asking messages, are we coming on live? Definitely, we are coming on live. We love you so much. And we know that the little that we've shared with you will come a long way to save a life. So our danger signs are headache, persistent vomiting, swelling of the feet, hands, and legs. We're also saying that when the baby moves too much or too slow, when there's convulsion, when the water breaks, when there's dizziness or fainting spells, when your body temperature increases than usual, when you have a smelly greenish or yellowish discharge coming out of your vagina, then severe abdominal pain, then bleeding. And also don't forget, 80% of miscarriages are caused by heavy bleeding in early sizes of pregnancy. That is first trimester of the pregnancy. Then we also said that varicosity also is part of danger signs in pregnancy. On behalf of my crew, would like to say thank you so much for coming our way. We love you. We care so much about you. Don't forget, this month is 3 things that we came with: Childhood Cancer Month, World Family Planning Day, then World Heart Day. So that should tell you September is fully packed. We are preparing you for October. October is Pink Month, which is Breast Cancer Awareness Month. We'll definitely come back. We'll come and add our voice to it. On behalf of PZ Customs Gas, we say we love you. More kisses for all my viewers and your patients. Bye.